Good afternoon. My name is Kang Young-sik, and I'm the chairman of the South North Korea Exchanges and Cooperation Support Association. This is the second day of the Korea Global Forum for Peace, and I would like to thank you for joining us at our session, which will be talking about UN sanctions and the humanitarian crisis in the DPRK. I would also like to extend my gratitude to our speakers, Dr. Lee Ju-sung and Ms. Yoon Joy, and also our discussants, Dr. Lee Kyu-chang, Director Im Hyung-jun, our Associate Research Fellow Lee Min-gyu, and also partner attorney Mr. David Wolf. I would like to also thank those who are joining us online, including Mr. Wolf. I understand that Washington is very late in the night or early in the morning, so thank you very much for joining us. As you probably know, COVID-19 has changed everything this year, and today we can also witness that things have indeed changed because we have no audience here. People are joining us connected by the web. So I think that we are now experiencing a new normal, untact era, and this will bring changes to inter-Korean relations as well. In particular, North Korea, in order to block the spread of COVID-19, starting from January, has actually blocked all of its borders. It has shut down its borders. It is completely isolated and therefore is experiencing much difficulties. Because of this shutdown of North Korea, the international community and the Korean NGOs' humanitarian support to North Korea has been suspended or delayed, and so we've not been able to provide the much needed aid to North Korea on time. As infectious diseases are on the rise, basic hygiene is not being provided to North Korea. This makes it very difficult to save lives. Many people are facing much challenges. And probably the situation was same in North Korea even before COVID-19. North Korea is faced with sanctions, and this makes it difficult to provide supplies, and also bank transfers are difficult as well. So the sanctions against North Korea has been implemented to stop the nuclear activities of North Korea, but it has had unintended impact on the North Korean society. And today at the session, we will be talking about how the North Korean support organizations and international organizations and humanitarian aid agencies can help North Korea overcome the challenges and think about what we can do. We'll also be looking at the current humanitarian crisis North Korea is facing and join our wisdom to overcome this crisis. We ask for your active participation. Now, before we begin the session in full-fledged, I would like to give some housekeeping notes. I'm sure that people who are joining us online would like to post some questions. We have provided you with a QR code, and we will be receiving questions or giving questions after the two speakers have given their presentation. So please utilize the QR code if you have any questions you would like to raise. So we have two speakers, like I said, and we have 4 panelists. Let me introduce them to you one by one. First of all, we have with us Mr. Lee Ju-sung, who's the Secretary General of the Korea NGO Council for Cooperation with North Korea. He has been working with World Vision Korea. He stepped down at the end of August this year, and since then, he has been working as a chairman of the South North Korea Exchanges and Cooperation Support Association, which is under the Ministry of Unification. To his left, we have the co-founder and director of educational therapy Ignis Community, Ms. Joy Yoon. She has been leading the Ignis Community, a nonprofit organization that specializes in treating children with developmental disabilities. It also has a Korean title, Seonyang Hana. She came all the way from Taebaek of Gangwon Province. Thank you for joining us. And now our panelists. To my far left, we have with us Dr. Lee Kyu-chang. And Dr. Lee Kyu-chang graduated from Korea University, majoring in law. He is currently the director of Humanitarianism and Cooperation Division at the Korean Institute for National unification. His major and focus of research is international law and North Korean law. We also have Director Im Hyung-jun with us from the WFP Global Office in Korea. And he has been working with the UNWFP since 2011. He has worked in Honduras, Guinea-Bissau, and Laos PDR. He also worked at the UNWFP headquarters in Rome in charge of the Asia Pacific. And currently he is in charge of the Korea office. He has held that post since 2011. To my far right, we have with us Dr. Lee Min-kyu. He is currently an associate research fellow at the Seoul Institute under the Seoul Metropolitan Government. He received his PhD at Peking University. He mainly studies China's foreign policy and Sino-American relations. I'm not sure if you can see him well, but we have with us, joining us online, Mr. David Wolf, who is a partner attorney at Crowell and Mooring LLP. He is an expert in commercial international law and commercial international relations, CMM. And so thank you for joining us. Hi, how are you? Yes. So now let us go straight into the presentations. We have two speakers. First, I would like to invite Dr. Lee Joo-sung.
With the topic, Current State of Humanitarian Crisis in the DPRK, you have 25 minutes. Good afternoon. I am the Chairman Lee Joo-sung of KNCCK. I joined World Vision in 1994, and since the early 2000s and up until the last day of the last month, I was in charge of cooperation with North Korea, and I was able to have a very close view towards North Korea. And I learned that people have different perspectives of North Korea. Even if they look at the same situation and numbers, the ability to interpret and understand what the data means were different among people, and people did not always know what is right. Facts disappear and only opinions remain. And in the end, you sometimes look at the DPRK with heavily contaminated data. We say that DPRK is unique. Yes, it is unique, but aren't we making the DPRK unique? And likewise for the private sector humanitarian NGOs in Korea, the DPRK, we believe, is still ongoing the difficulties from the arduous march. But on the other hand, there are some who say that humanitarian aid is no longer needed at North Korea. I have experience on the field and I work in solidarity with many other NGO groups. But what little knowledge I have of DPRK, I'm not sure if I really have the full information. Maybe I am just groping with what little information I have to understand the DPRK. So first I'd like to look at the humanitarian state of the DPRK with a focus on infants and toddlers and their state of nourishment, and also look at economic and food supply factors to discuss the humanitarian crisis at the DPRK. Let's start with the state of humanitarian conditions. Up from 1998 to 2017, we looked at the undernutrition and malnutrition, of infants and toddlers in the DPRK, and you can see that there has been some great progress made at a high pace. The rate of malnutrition was 62.3% in 1998 and dropped to 45.2% in 2000 and all the way down to 19.1% in 2017. And the low weight rate went from 60.6% to 9.3% from 1998 to 2017. During the same period, the acute malnutrition rate was down from 15.6% to 2.5%. But as of 2017, the DPRK shows way higher rate of chronic malnutrition of infants and toddlers compared to that of upper middle income countries at 6.4% and that of high income countries at 2.5%, because the figure for North Korea is 19.1%. So this shows that the DPRK is still in a very, very dire situation, at least in numbers. There was the sanctions against the DPRK in 2016, and because of the COVID-19 pandemic, North Korea had to shut down its borders, and we believe that this is causing a huge crisis at the DPRK, and we need to closely monitor the situation of children and disabled persons in vulnerable regions. So, by region, except for Yangon and Pyongyang, the malnutrition rate has been dropping. Yangon still has a high rate of chronic malnutrition, whereas Pyongyang has a very low rate. But if you look at everywhere in between, the gap has been closing. So this means that there's a bipolarization in the state of chronic malnutrition in the DPRK. Going forward, in order to minimize chronic malnutrition and the gap between regions, we must focus our inter-Korean cooperation. That is the message we can obtain from this chart. Next are the tasks and factors behind nutritional improvement among DPRK infants and toddlers. Nutritional conditions of infants and toddlers are influenced by food availability, household income, mother-child health, and health environment. As for food security, from the early 2000s, food aid has been coming in from the international society, which accounted for 25% of total food supply. But by the late 2000s, despite that food security went worse or little improved, improving trend in nutrition continued. Why? Since arduous March, individual survival strategies started to be conceived. During the COVID world, South Koreans at first couldn't get a hold of facial masks, but now they are mounting these masks at home. So people tend to just prepare for an emergency situation. And that is the same in North Korea. I believe that individuals in North Korea are preparing for emergencies. And it is very difficult to statistically estimate the production volume from private farmlands, including fields. And food accessibility through marketization has been improving. But this access through the market is again bipolarized because the vulnerable have more and more difficulty accessing food through the market. In terms of income, based on the GDP of the DPRK, the Bank of Korea estimated that there is not much of an improvement in income level. There's very little proof that income level increase actually impacted nutritional improvement, meaning that regardless of the income level of the DPRK, nutrition has been improving in the DPRK for infants and toddlers. And socially, DPRK overcame the arduous march and is heading for a recovery of nutrition because it has a social experience of social development apart from other underdeveloped countries, because back in the days, North Korea had a better economic situation than South Korea. They already have experience of social development. They know what to do and why, and what to do first. One notable example is that vaccination coverage of one-year-old children already reached 100% in the early 90s, then dropped in the mid-90s, but rebounded in a sharp V shape back to the original level. However, the state of malnutrition in the DPRK is still 26th out from the bottom out of 117 countries. So that means DPRK is number 91 out of 117 countries in terms of famine, according to Concern Worldwide. And as for needs and priority, DPRK needs and priorities, they have said that more than 10 million need nutritional aid and 8.4 million lack safe drinking water. steady and urgent humanitarian aids, not just for access to quality necessary healthy services, but to clean drinking water and sanitary facility are needed. Let us look at the economic factors of the DPRK. After the fourth nuclear test in 2016, a strong sanctions against the DPRK was imposed, and a maximum of $5.8 billion of DPRK China trade volumes in 2016 shrunk to $2.8 billion in 2019. And because of the sanctions, GDP growth rate sharply went down from 3.9% in 2016 to minus 3.5% in 2017 and minus 4.1% in 2018, according to estimates from the Bank of Korea. And this year, in the first 2 months, year over year, trade volumes between DPRK and China shrunk by 71% in imports and 23% in exports. And also in March and April, imports and exports dropped by more than 90%. Because the DPRK shut down its borders, no supply can enter the country from the outside. According to a daily NK report, the DPRK announced that import will be suspended by the end of the year, according to a joint communique between the Central Committee of the Workers' Party of Korea and the cabinet. So the DPRK is at a dilemma. To prevent the spread of the COVID-19, they have to shut down borders, but border shutdown will hinder trade. But nevertheless, because of the COVID situation, they cannot reopen the border anytime soon. And the DPRK said as much very clearly in the joint communique. And so internal production is very small and there's no import either. In order to overcome this situation, does the DPRK have some special self-help measure, or are they in a very, very difficult situation? That is the basic question we need to answer. And let's look at the food supply in the DPRK. Last year, the Statistics Korea estimated that the DPRK produced 4.64 million tons of food last year, which is a 90,000 ton increase YOY. So gradually, the food production in the DPRK is getting better and better. But recently, the pace of growth has been quite low. WFP estimated that 5.75 million tons of food is a minimum amount required in the DPRK. So that means about 1.11 million tons is still lacking in the DPRK. Through self-reliance and self-sufficient measures, the DPRK wants to overcome food insecurity, but in the short term, it'll be very difficult to achieve that. Sanctions on crop production is quite little, according to experts. And any materials or food going into the DPRK goes through China. But how much food goes into DPRK from China is what this slide shows. So in 2017, crop import from China to DPRK increased 220% YOY. Import volume stood at 239,000 tons in 2018. And in 2019, 337,000 tons were imported, which is the largest volume of commercial crops since 2013. But in Q1 2020, food import volumes markedly went down. In Q1, $13.7 million of food entered the DPRK, but back in 2019, the amount was $179.18 million. So that's a huge decrease. For North Korea to farm, North Korea would need fertilizers. But again, fertilizer is in shortage. So the lack of fertilization means that there will be very little crop harvest this year. And food production and supply issues in the DPRK this year. What will happen to food production and supply? food aids of the international community to the DPRK has sharply decreased since 2013, a mere 20,000 tons of food aid provided annually recently. And as I said, fertilizer supply has also been very, very low. And we predict that the fertilizer in stock is a very low level in North Korea. And also, this year there has been a severe amount of downpour in North Korea. And some scholars believe that in the South Hwanghae province, which is the home of farming of North Korea, if that region is hit by too much rain or typhoon, up to 500,000 tons of food supply can just simply disappear. Due to sanctions and COVID-19, DPRK is expected to have difficulties in food production, so this warrants attention and cooperation from Korea and the international community. So South Korea and international society is very frustrated about the situation in North Korea because the sanctions against North Korea even impacts humanitarian support to North Korea, and North Korea shut down its borders. It is refusing to talk or meet with others, and no project can really keep going in North Korea. So, plus, we are very worried about the situation in North Korea, plus, and we feel very guilty and sorry that there's nothing we can do for them. And another, adding to the frustration, is that over the past decades, we have built trust and continued on with projects, but overnight, all that effort was rendered useless. Of course, North Korea values private sector cooperation with South Korea. They trust South Korea's private sector, and likewise for South Korea's private sector, vice versa. So I think it is high time that private sector takes the initiative. But the private sector also, since May 24th measures, have very, very little experience of actually meeting face to face with the North and talking to them. So they have very little knowledge of how much change has happened in North Korea. And sometimes they present very unrealistic goals and projects. North Korea says that they have changed and they want new ways of cooperation, but the South Korean private sector wants to see if that is true, but there's no way to see that. So we are in a way mired in the past, and we only have a very obsolete kind of perspective. But going forward, cooperation has to change. In 2018, when I met with the North Korean colleagues, they told me that let's cooperate to the benefit of both South and North Korea. So they want to pursue projects that is beneficial for South Korea as well, not just unilaterally receive support from South Korea. So that is what they want to do, and they want to gather ideas on how to do this. Of course, the DPRK needs humanitarian aid, but in a different way than the past. The private sector needs to acquire new expertise and capacity and work in solidarity with the international community. As I said earlier, there is regional gap, bipolarization in North Korea. So our projects and the target of our projects need to change as well. So to that end, North and South Korea must meet face to face and understand what each other want, how the cooperation should go. All this should be discussed very much in detail. I hope that day comes as soon as possible. Thank you. I will conclude my remarks here.
예, 수고하셨습니다.
Thank you very much, Dr. Lee. Secretary General Lee has been engaged in projects for North Korea for almost 20 years, and he has actually visited North Korea as well, one of the few people that have done so in South Korea. And as part of World Vision, providing food supply to DPRK was one of the very biggest successes that even North Korea recognizes. And I understand that your thorough dedication for decades to North Korea. Thank you very much. And Mr. Lee has saved us time, so I can give more time to other speakers. And I'm sure that we have some of the audience joining us from abroad online. And one of the key situations in North Korea is low weight among children of 5 years old or younger. That is 9.3%. But there's no low weight rate in Korea. It's 0.0%. Those who are underweight in Korea, the young children, are very, very they have a condition, physical condition. But on the other hand, South Korea has overweight people, and there are no overweight people in the DPRK. So it's the same Korea, but if you're born in Korea, you have 9% chance of being underweight. But if you're born in South Korea, within 5 years of your birth, there is 8% chance of you becoming overweight. So that just shows the stark contrast between the two Koreas. In 2018, in Pyongyang, the two summits of North and South Korea met and agreed to a balanced economic development of the people of Korea that aims for economic development, but also to ensure that children, wherever they're born, would have the same level of right to health, so that we can ultimately achieve peaceful development and balanced development. So in that sense, I would like to thank Mr. Lee for presenting us with your numbers. And as a Secretary General of KNCCK, all the best.
여기 있으니까 다음에 조윤 선생님께서는 뭐
So I think I can give Ms. Choi Yoon about 25 to 30 minutes. She actually has experience of spending over 10 years living and working in the DPRK. She's an American. Now it may be difficult for her to visit the DPRK, but she's an expert in the field. She has worked on treating children with developmental disabilities. She has worked in the field of treatment and also education. And I understand that she has been in charge for special education at the Pyongyang Spine Rehabilitation Center in North Korea. I'm sure that she finds it quite unfortunate that it's difficult for her to visit Pyongyang these days. Are you going to speak in English or Korean? In English. Okay, so we do have simultaneous interpretation. So I will give you 25 to 30 minutes.
Thank you so much. It is a privilege for me to share with you today. I will be sharing particularly on global sanctions on the DPRK and its implication on humanitarian assistance. My name is Joy Yoon, and I am one of the few Americans who has lived and worked in North Korea for over 10 years. For over 12 years, my husband and I have co-founded our organization and have been working in the DPRK through our nonprofit known as Ignis Community, or otherwise Sanyang Hana Foundation in South Korea. Ignis Community is an international organization supported by various individuals from all around the world, including individuals from Korea, but also the United States, China, and Philippines, Mongolia, Singapore, and even Brazil. Our humanitarian assistance in North Korea has included a variety of outreaches, including food and medical donations, particularly in the Northeast area and for disaster relief, shoe donations to orphanages and child care facilities in remote areas, and medical training through our Pyongyang Spine Rehabilitation Center. One of Ignis's primary focuses is to help get medical treatment for children with developmental disabilities, a demographic with very few resources in North Korea. Take, for example, Blessing. Look closely at Blessing's innocent face. She is one real child out of thousands that we have the opportunity to help in North Korea. Blessing is from the northeast region of North Korea and has quadriplegic, spastic cerebral palsy. Like most disabled children in North Korea, Blessing was kept secretly at home. Even the family's closest friends and coworkers did not know that Blessing existed. At the age of 4, she could not chew her food or voluntarily move her muscles. Blessing's grandmother kept her alive by chewing her food for her and then spooning it into Blessing's mouth and helping her to swallow. It took Blessing several days to travel from the Northeast region in North Korea to the capital city of Pyongyang, where we are developing a treatment for children with cerebral palsy in the Pyongyang Spine Rehabilitation Center. As the first training hospital for pediatric rehabilitation, the center will provide medical and therapeutic services for children with cerebral palsy, autism, and other developmental disabilities. Here, Blessing was able to learn how to voluntarily operate her mouth muscles, roll over, and even sit up for the first time. Blessing helped catalyze treatment for thousands of children like her throughout the country. Prior to our program, no official treatment existed for children like Blessing. But once people started to see Blessing being treated in the hospital, they started to call their friends and family back in their hometowns, exclaiming, "A child like yours is being treated in the hospital. Quick, bring your child to Pyongyang." Mothers started lining up with their children as we began the first official treatment for children with cerebral palsy in North Korea. Now doctors are also being trained in the hospital in treatment methodologies at the Pyongyang Medical School Hospital. And we are developing a rehabilitation center that has the potential to treat 450 outpatients and 30 inpatients every day. The North Korean Ministry of Public Health is also working to establish rehabilitation in all the pediatric provincial hospitals. We have already begun these rehabilitation centers in Pyeongseong, just north of Pyongyang, in Nampo on the west coast, and in Wonsan's Children's Provincial Hospital on the east coast of North Korea. Unfortunately for Blessing, it was not a happy ending. Due to the limited number of patients we can treat until the rehabilitation center is complete, Blessing returned to her home province to wait for her next round of treatment. When we went to the Northeast region to invite her back for treatment, her father met us and explained, "I'm sorry, Blessing is no longer with us. She has passed on." Although having a developmental disability is typically not a life-threatening condition in a developed nation, in developing nations like North Korea, where life is even difficult for able-bodied people, the fact is that children with disabilities often do not survive. With the increase in sanctions imposed on North Korea, Ignis's success is at risk, and children like Blessing are having a harder time getting the treatment that they so desperately need. In December of 2017, the UN Security Council passed Resolution 2397, which bans the import of metal, and as a result, medical equipment such as needles, syringes, stethoscopes, rehabilitation equipment, and even lab diagnostic equipment from entering the country. This has significantly delayed the development of our Pyongyang Spine Rehabilitation Center. Although it is possible to get an exemption for humanitarian-related items, the process can be subject to burdensome delays. The United States and the United Nations both state that they have no intention of hurting the common people of North Korea or hindering humanitarian assistance to the most needy in the DPRK. However, the reality of providing humanitarian aid to North Korea is quite the opposite. The current political climate challenges even large nonprofit organizations and NGOs, such as even the Red Cross, and difficulties for the World Health Organization to overcome obstacles and reconsider their involvement in the DPRK. As you can see, this is a list of all the medical nonprofit organizations that have been working in North Korea. Since it takes years to navigate and request all the necessary governmental permits and licenses to provide life-saving humanitarian assistance to the most vulnerable in North Korea, several of these organizations are currently no longer able to continue operating in the DPRK. Sanctions are intended to pressure the government towards denuclearization. But what we are discovering is that instead of hurting the elite, Sanctions are preventing humanitarian aid from entering the country and are causing deaths, particularly among women and children. It is estimated that in the year of 2018 alone, approximately up to 4,000 North Koreans could have died as a direct result of sanctions. Unfortunately, politics are taking precedence over the value of human life. In the comprehensive report, of which I and a team of independent authors collaborated together on, is entitled The Human Costs and Gendered Impact of Sanctions on North Korea. In that report, it is estimated that approximately 11 million men, women, and children lack sufficient nutritious food, clean drinking water, or access to basic services like health and sanitation. This affects over 40% of the population. In particular, women are disproportionately affected. Due to the UN resolution, starting in September 2017, Chinese joint venture companies were also required to close and leave the DPRK. This directly affected the textile industry, which primarily employs women, including our own organization's shoe manufacturing social entrepreneurship in the Rason Free Economic Zone. The report emphasizes that international sanctions undermine women's status in North Korea, negatively impacting their economic and social rights, and thus inhibiting them from engaging in civic and political life. The current extent of sanctions on North Korea, though, is so severe that even humanitarian organizations have difficulty shipping medical equipment and food into the nation. This is not only because of what is explicitly stated in the sanctions, but also because U.S. sanctions have highly discouraged banks from working with nonprofit organizations on the ground in North Korea. These banking issues are the number one reason why many nonprofit organizations are no longer able to operate in the DPRK. Even travel permits to U.S. NGO workers have been denied at times by the U.S. State Department. As all U.S. citizens are banned from traveling to the DPRK, the State Department states that they are preparing multiple entry special validation passports for humanitarian workers. However, because of the coronavirus outbreak, all current special validation passport applications for DPRK-related humanitarian purposes are currently being automatically denied. This video is a summary of the comprehensive report that I mentioned and a summary of the current humanitarian situation in North Korea. As a result of these UN and US sanctions, our organization, Ignis Community, has been delayed in being able to provide the immediate humanitarian assistance that children in North Korea need.
Since 2016, I've noticed a significant change in the way the North Korean doctors were treating their patients. What I saw was that they were having trouble getting basic supplies. Recently, I was given a scalpel, and it was rusty, and it was dull, and it was clear that this scalpel had been reused multiple times before. And that's when I realized that things are very difficult for North Korean doctors. In fact, it's not just a scalpel they're reusing. Things like gauze, catheters, They're all being cleaned. Gloves as well, surgical gloves, are being cleaned, re-sterilized, and used over and over again until they become unusable.
Humanitarian assistance should not be subject to political whims, but should be separate from any sanctions that are imposed upon North Korea.
As a doctor, I believe in the principle of do no harm. And in this case, the sanctions are actually harming people. What I'm finding myself as a humanitarian worker is having to ask permission to save lives. And we should never have to ask permission to save lives.
IGNIS community began applying for the appropriate licenses to provide humanitarian assistance to the DPRK in 2016. To continue our life-saving work for children with disabilities, our organization was required to obtain a license from the U.S. Treasury Department, a BIS license from the Commerce Department, and an exemption from the UN Sanctions Committee, in addition to special validation passports every time we visit the DPRK. We finally obtained all necessary licenses for the development of the treatment center in September of last year, over 3 years after we began the process. Our case is not unique. Providing humanitarian aid to the DPRK requires years of applying for permits and licenses, not only from the United States, but from the United Nations. Legal expertise is also necessary to navigate the technical requirements to operate in North Korea, decreasing and delaying the delivery of humanitarian assistance. In the meantime, the common people of North Korea who need the help the most are the ones who are suffering. Now, with the global outbreak of COVID-19, humanitarian organizations are facing yet another layer of obstacles, making humanitarian work nearly impossible in the DPRK. Providing humanitarian assistance to North Korea was never easy. It required working with multiple governments, including not only the DPRK government, but also the Chinese government and our home country governments. This is because all humanitarian aid has to be shipped into the DPRK through China. But at the same time, we have to abide by the laws of our home countries. For IGNIS community, also known as Sanyang Hana, this means cooperating with 4 governments: the US government, the South Korea Ministry of Unification, Chinese Customs, and the DPRK government. Because of these complications, when global sanctions were imposed upon the DPRK, many nonprofit organizations were forced to stop operating in the country. But now with the coronavirus outbreak, just about all humanitarian work in North Korea has stopped. The borders to the DPRK are closed, and many humanitarian shipments being sent into the country have been delayed. With strict procedures in place to prevent the spread of COVID-19, few vessels are traveling back and forth from ports in China to the DPRK. Many humanitarian organizations have shipments that have been waiting for up to 8 months in China and have yet to be delivered to the people of North Korea. Miraculously, IGNIS community, known as Sanyang Hana, was able to ship 3 40-foot containers of medical equipment into Pyongyang, which arrived on June 14th this year. However, our second larger shipment of medical equipment is now stalled due to the recent outbreak of coronavirus in Dalian, China. In the midst of a worldwide pandemic, humanitarian engagement with any country, regardless of politics, should be fueled by the desire to save lives. The value of human life should always supersede the state of diplomatic relations with any country. Currently, the DPRK is affected not only by sanctions and COVID-19, but is also currently experiencing flooding and severe typhoons, causing the humanitarian situation on the ground to be even worse. Humanitarian assistance should not be subject to political whims around us, but should be separated from other sanctions imposed upon North Korea. Therefore, the authors and organizations involved in this comprehensive report I mentioned have called for an immediate review and modification of the current global sanctions on the DPRK. Otherwise, we are turning our backs on actual innocent children like Blessing, just as we have the chance to bring them the help that they need. It has been my privilege to share with you today. If opportunity arises, I'd be happy to answer any questions you might have regarding humanitarian work in the DPRK.
조윤 선생님.
Yes, thank you very much, Ms. Yoon. And you talked about blessing. And I do believe that she is in heaven. And she was blessed because she was able to meet you and receive treatment. I understand that there are many challenges because of the sanctions against North Korea, and you mentioned them. I think that a lot of the Korean NGOs are experiencing the same challenges regarding the delay of shipments and etc. But I think that not only the sanctions, but also the complexity of having to cooperate with so many different governments, the North Korean government and the Chinese government, makes the situation even more difficult. So you mentioned about that. And also the UN sanctions against North Korea is also heavily affecting humanitarian aid activities to North Korea, especially it's impacting women and children. So I think that perhaps later on, Dr. Lee Min-gyu and Mr. Wolf might want to touch upon that later. So we've heard both speakers give their presentations, and now it's time to go on to our four panelists. First of all, I would like to invite Dr. Lee Gyu-chung from KINU.
주시고요. 나머지 그다음에
Followed by Mr. Im Hyung-jun, Lee Min-gyu, and last but not least, Mr. David Wolf. So I give you each 10 to 12 minutes, and maybe even more, because our two speakers have kept their time very well. So let's start with Dr. Lee from KINU. Good afternoon. I am Lee Gyu-chung from KINU. My very office, the Humanitarian and Cooperation Research Division, is in charge of researching the state of humanitarian crisis in the DPRK. So we heard from Mr. Lee Ju-sung of KNCCK and also Ms. Jo Yoon from the Ignis community, and we were able to hear very, very vivid stories of what is happening in the DPRK. When we think of the vulnerable class in the DPRK, we think of young children, the elderly, the disabled, and women. The two speakers focused on the women and young children. Although not mentioned today, the human rights of the disabled persons in North Korea is very, very serious as well. Recently, not only all these the vulnerable people, but the people of North Korea in general, I think, are all vulnerable in some way. And because of the sanctions, not the privileged class of North Korea, but the general public of North Korea have a very harsh life, plus COVID-19, flooding, and typhoons that have put them in a double, triple whammy. I don't have anything to object to against anything that's been said by the two speakers, but I just have a comment and a simple question. Chairman Lee, you mentioned the economic state and the lack of food in the DPRK. And first, you cited UNICEF's numbers to look at the malnutrition of infants and toddlers. Overall, the situation has been improving, and the food production has been growing for a few years before 2018, but in 2018 and 2019, food production went down. But last year again, the food production actually slightly increased. The numbers differ depending on the research institution, but we understand that there has been a 900,000 ton increase last year, as we have seen from the presentation by Mr. Lee. And there are some UN organizations, the UN DPRK team, that are stationed in the DPRK, and they issue a report, annual report on the needs and priorities of the DPRK. And the recently released report cites numbers from the Agricultural Department of the DPRK, and they said that 665 or 6.65 million tons of food production was recorded last year, which is a huge increase. Although the numbers slightly differ, there is clearly a general increase in food production. Although food production has increased in the DPRK, the food shortage among the general public of the DPRK is still in a very, very difficult situation. So we call this a complex humanitarian crisis. The UN DPRK team said that 10.4 million North Koreans are in need of better nourishment and food. So that is about 40% of the total population of the DPRK. So 1 out of 4 North Koreans are in need of nourishment or food. And today, they are also hit by COVID-19, which will probably make situations worse. The report from the UN DPRK team stated that the prolonged droughts, flooding, and the lack of agricultural equipment will continue on the food shortage in the DPRK. And the Ministry of Unification of South Korea also shares the same view. About 860,000 tons of food will be in shortage in the DPRK. We will have to wait a little more for the accurate numbers to come out, but we're sure that because of the climate situation and the COVID-19 situation in North Korea will be very bad. There is official and unofficial economy in the DPRK. COVID-19 is likely to have had a greater damage to the unofficial economy that impacts the general public. And this may fuel and widen the gap of bipolarization. And since North Korea shut down its borders to prevent the spread of the virus, that means Chinese products are not entering North Korea, and the 장마당 revenue will go down while inflation is going up. So the market functions, we believe, will be stagnant or turning worse. And another point, notably, is that we call DPRK as a Pyongyang Republic. So Pyongyang, the gap between Pyongyang and all the other regions is huge. And if those who live in Pyongyang are considered to be the elite, the privileged class. And this June, there was the extended meeting of the Politburo and said that there was an important resolution taken to provide better water and food to the people, meaning that COVID-19 is now impacting the people in Pyongyang, not just the people in other regions, indicating a very serious humanitarian situation in the DPRK. So while a humanitarian crisis continues in the DPRK, humanitarian aid to the DPRK, albeit difficult, must continue. The Special Rapporteur, Thomas O'Hea, annually issues his report, and this February he issued another report and said that the international sanctions on the DPRK is having a negative impact on the lives of the general public of the DPRK, and that to the shutdown of the borders to prevent COVID-19 may make matters worse. And of course, there was the human rights resolution on North Korea this year by the UN, which at a later time than previous years. And here, there was notion that the humanitarian aid should be provided to the DPRK because the situation will get worse this year for the DPRK. But when providing humanitarian aid, we need to work with the DPRK. The DPRK needs to respond positively. And through multiple channels, we have been suggesting help to the DPRK, but the DPRK has been refusing to receive help from South Korea. For example, providing Tamiflu under humanitarian healthcare support was suggested by South Korea at the relevant authority level, but the DPRK has refused that. And as for African swine flu, the African swine flu situation in the DPRK has not ended yet. It has just been overshadowed by COVID-19, but of course, DPRK refused support on that matter, as well as food support from South Korea. So going through the international community or the private sector, well, that's a different story because the DPRK is willing to accept those aids. We call it the 1718 Council of the UNSC. You can go to the website and read the information. Doctors Without Borders, the Ignis community, and other private sector groups or NGOs and other international groups have been providing help regarding COVID-19 and other types of help to the DPRK. But the IFRC or the WHO has applied to be exempted from the Sanctions Committee, and they have been exempted, and they have been providing help to the DPRK accordingly. And while DPRK receives humanitarian support and political leaders approve the idea of receiving help from South Korea, that will be a big breakthrough. And as Ms. Yoon has mentioned, the goal of sanctions is really to avoid any detrimental impact to the general people of the DPRK, and other resolutions of the UNSC have similar provisions. But the problem is that sometimes the sanctions unintentionally have a negative impact on the lives of the people. For example, when it comes to food shortage or fuel or equipment, there are sanctions on imports of oil or other fuels, which will ultimately have a bad or negative impact on the lives of the people. And in the long run, it will be best for the sanctions to be partially or completely lifted. But right now, that is a very hard thing to happen. And while sanctions are in place, although the sanctions aim to avoid any detrimental impact to the public, we still need to minimize any negative impact on the lives of the North Koreans due to sanctions, and devise a mechanism to monitor the lives of people and how their lives are impacted by the sanctions. Last but not least, I have a question to Ms. Yoon.
2018년에
Now, during your presentation, you said that 4,000 people are estimated to have directly died because of the impact of the sanctions. So the sanctions against North Korea, well, I want to ask, what was this research based on? Can you give some more specific details about this statistic? Thank you. I would like to conclude my talk. Yes, thank you very much, Dr. Lee. And the last question was forwarded to Ms. Choi Yoon. You can answer later. Now, it's not only the sanctions against North Korea that influences humanitarian aid to North Korea. There's also the inter-Korean relations. For example, North Korea's attitude towards South Korea. Well, I think that he's mentioned about this political factor as well. But the African swine flu or COVID-19, well, there has been multiple proposals by South Korea to assist North Korea in these areas, but North Korea has not responded. And also, there are some issues such as transporting the supplies through the DMZ. The UNC has not actually approved this. So there are a number of challenges surrounding inter-Korean relations and also aid to North Korea or humanitarian support. Next, we would like to go to Director Lim from the WFP. I understand that you have prepared something that you want to share with the audience here today. today? Yes. Thank you very much. My name is Im Hyung-jun, and I'm the director of the WFP Global Office in Korea under the UN World Food Program. Thank you very much to the two speakers. Now, Dr. Lee Ju-sung talked about the situation in North Korea, especially related to the food situation, and Ms. Choi Yoon talked about the difficulties and challenges of humanitarian aid to North Korea. COVID-19 has made situations even more worse for developing countries. We released a report on the food crisis in April, and we believe that the number of people who are suffering from the food crisis will increase to 270 million, and the situation has exacerbated because of COVID-19. Now, we were able to aid 100 million, but we have increased our capacity to help 140 million. So we have been taking various measures to aid people who have been hard hit by COVID-19. And also, there has been some restrictions that has been put into place. For example, the restriction on travel and etc. The schools and the daycare centers have been closed from January to June. And also, we have been seeing implementation of quarantine measures here in Korea, South Korea as well. So we don't have the specific data, but based on what we've heard and based on our sources, the schools and the daycare centers have been shut down in North Korea. Based on our sources, the food supply and also, for example, the lunch that have been provided to the schools and the daycare centers have been suspended. And usually, market activities and support from relatives has been a source of economic aid to some of the families in North Korea, but this has been suspended as well because of the lockdown and the shutdown of the borders. I understand that the UN has provided emergency aid worth $40 million to North Korea, and most of it was in the field of healthcare. And also, I understand that quarantine is a major issue, and also supply chain costs has to be taken care of. So that's what we're interested as well. Now, humanitarian aid is based on the principle of equality. We believe that anyone in this world have the right to receive aid to ensure their basic rights, and they have the right to not be in pain and suffering. And so that is a basis of humanitarian aid. Of the WFP, starting from the mid-1990s until the mid-2000s, we have been providing large-scale food support. And also after that, we have been focusing on targeted intervention, targeting the vulnerable class of society to ensure that they do not suffer malnutrition. We talk about hidden hunger, especially for the first 1,000 days of a child up to the age of 2. The first 1,000 days are very important for the growth of children. If you are malnutritioned during that time, then you will be stunted for life. It is difficult to actually recover from that stunted situation if you don't take care of it within the first 1,000 days. So in 2019, 2020, 2021, we will be carrying out a $161 million project to tackle this issue of malnutrition and hidden hunger. So actually, if you look at the statistics, if you invest $1 in nutrition, one can save an average of $45 and up to $166 of health costs. And also, if you invest $1 in nutrition in a timely manner, the return on investment on this would be 16. So also, investment in nutrition has a major impact on countries' national GDP as well, according to our research. So that's why we have been focusing our attention on activities related to nutrition provision. This is actually food that contains super cereal, and especially this can be of great help for pregnant women. And also for children, actually, this can be used to make pancakes or snacks for these children. And also, we provide nutrition fortified biscuits for North Korean children. We also have booklets that we publish which hold important messages about nutrition, and we hand these booklets out. In 2019, the WFP has provided aid to about 662,570 people, mostly pregnant women and children. So we have resumed our activities in July of this year, and up till now we have provided aid to about 448,000 people. Can you put up my slides, please? So here you will find 3 children. One is 12 years old, another is 9 years old, and another is about 6 years old. You can see that they are of similar height. This is because the 2 of them are suffering malnutrition. Johnny suffers severe malnutrition, Glenda moderate malnutrition, and Daniel normal. And then if you look at the map here, it covers the areas that we are engaging in aid activities. So you can see that the blue actually covers the areas where we are actively engaging in activities. And also you can see where we are producing super cereal, super seeds. We have 11 production plants. And this is a photo of the factory that produces super cereals and nutritious biscuits. So these super cereal are used to make bread, for example, and these are provided to young children. Or it can be used to make porridge for the children. And also you can see our workers out in the field. Our workers continue to do monitoring. So this is the end of what I've prepared. Thank you for your attention. Yes, thank you very much. So that was very important and valuable information that you provided with us. I think that we can go into the topics that you covered later during the panel discussion. And third, Dr. Lee Kyu-chang.
I'm sorry, it's actually Dr. Lee Min-gyu. Could you focus on sanctions, please? Good afternoon. I am Lee Min-gyu from the Seoul Institute. Earlier, we heard how humanitarian support to DPRK is very difficult and how dire the situation is in the DPRK. The biggest point of dispute in providing humanitarian support to the DPRK is the UNSC sanctions that is imposed to North Korea. And amid the sanctions, is it possible and needed to provide humanitarian support nevertheless? And if so, how and what can we do? Well, as has been mentioned several times, the UNSC sanctions clearly states that sanctions on the DPRK shall not have detrimental impact on the humanitarian lives of the DPRK. To be more specific, if you look at the sanctions, the sanction itself states severe concern of the situation of the DPRK, and it is important to respect the dignity of the people of the DPRK. And international organizations, NGOs that provide humanitarian support to the DPRK shall not be banned or hindered. That is not the intent of the sanctions. And more importantly, the government of the DPRK should take more care about how the humanitarian support can reach the people of the DPRK even. So that is the basic stance of the sanctions. So in 2017, since the resolution 2317, citing another report for women, pregnant women, children of 5 years or younger, these people need humanitarian support, and actually the support has led to some tangible results. And Resolution 2397 points to the fact that about 40% of North Koreans suffer malnutrition. So unlike our understanding and common sense, if we look at the sanctions one by one, steel, iron ore, refined petrochemicals, supply of these products to the DPRK, if connected to the very survival and life of the public, is possible. And even ships calling to port is allowed if it gains exemptions from the sanctions. And bank account, if bank account a wire transfer to a bank account is a part of humanitarian support, that is also possible. So not only food supply, but anything that's related to the livelihood of the people. One of the most severely sanctioned items, such as iron ore and petrochemicals, are allowed to be provided to the DPRK. And as you know, in 2018, on August 6th, there was a new system that was announced to allow for exemptions of the sanctions to allow humanitarian support to the DPRK, understanding that there are many in the humanitarian support arena who appeal for the sanctions to be exempted. So in step with that appeal, the UNSC decided and announced the details of how that exemption can be obtained through application. And as mentioned, if you just look at the sanctions itself, humanitarian support to DPRK is not exactly difficult. But as you have shared your actual on-the-field experience, realistically speaking, there are many, many obstacles. So the basic idea of the sanctions is to allow humanitarian support to the DPRK. But why is it difficult to do realistically? So let's look at the sanctions in this perspective. So I downloaded all the full text of the sanctions on 10 items. I think it can be categorized into 11 different groups: weapons and materials, selling and exporting transition, technological transfer or advice, financial sanctions are also imposed, cargo inspection, airports and ships, no dispatch of experts, individual and group sanctions. There are a total of 11 different categories of the sanctions. Although humanitarian support is possible, humanitarian support under the UNSC sanctions must be in compliance with these 11 categories of the sanctions in order to be provided. So in 2018, August, if you look at the exemption system in detail, the recipient, the date, the method and route, the counterparties, what is treated, all the items involved must be written out and submitted. And another thing is that they need a written form of guarantee that such items will not be used for ulterior motives or other uses. So basic idea is that the sanction allows humanitarian crisis, but these complex sanction conditions must be met for humanitarian support to be provided to the DPRK. So although it is possible to provide humanitarian support to the DPRK, they experience huge amount of challenges. And U.S. also has their own separate sanctions against the DPRK. So considering the situation as a whole, and we also must consider the U.S. independent sanctions against the DPRK, the situation becomes more complex. And we know that humanitarian support is needed and possible to be provided to DPRK, but how do we overcome the challenges? I would just like to make 2 points. Number one, As has been mentioned, the second U.S. North Korea summit collapsed, and ever since, relations with North Korea and South Korea has also been at a stalemate. So, amid the situation, rather than the government taking the initiative to provide humanitarian support, it is better for the NGOs or civic groups or humanitarian groups to work to the fullest to provide humanitarian support to the DPRK. So that kind of a detour is very much needed for three reasons. First, in 2018, when the intercurrent relations was very good, government level of humanitarian support to the DPRK should have been taken more actively. And in that case, maybe we wouldn't be facing these challenges that we face today. But now that the intercurrent relations has already been at a stalemate, using the humanitarian support as something of a card to ultimately lead to inter-Korean cooperation, that is not such a good idea. And secondly, as many of the press releases report, even humanitarian support to the DPRK is considered in South Korea to be a unilateral and unconditional support and too much to give to the DPRK. So to overcome this public opinion, we must work hand in hand with the international community in order to dispel this distrust among the South Korean public opinion, by raising transparency and also making the projects more feasible. So in this situation, going back to my point, working hand in hand with the international community and humanitarian NGOs, I think the government and all the levels of society must work together. And my second reason would be that these are some of the media report. UN Secretary General on March 26th urged that sanctions exemption need be widened. And then in April, humanitarian exemption should be applied to allow for humanitarian supplies to enter North Korea. And then also in both houses of parliament in the U.S., a relevant bill has been passed. So that all happened this year. And I mentioned these three points because denuclearization and humanitarian issue must be distinguished from one another. And to do that, we need international consensus and empathy. And to obtain empathy, we need to work with the UN and US and persuade them that humanitarian support is very much needed. Right now, while relations between US and the DPRK are strained, and while sanctions continue by the US upon DPRK, this peaceful diplomacy by South Korea must be unfolding more actively. And unfortunately, the silver lining is that since 2019, at the UN level, humanitarian support has become easier and more widely recognized. There's an increase of support provided that increased to 38 cases. And right now, the exemption is being obtained more quickly as well. So since 2019, at the UN level, we do see some more flexibility in the UN stance when it comes to humanitarian support to the DPRK. And to accelerate this change, we can also work to gain the support of the UN and also the international community. Thank you, Dr. Lee. Dr. Lee is a scholar who researches sanctions against DPRK, and your comments were quite meaningful. And you also said that South Korean government should take the initiative to avoid using humanitarian support as a card to improve inter-Korean relations, because humanitarian support should be for humanitarian support only. So we need to circumvent and work with the international community and the humanitarian NGOs to provide better support to the DPRK. And yes, humanitarian support can happen, but when you want to actually do it on the field, you have to go through a very complex round of process.
Yes, I'm sure that Mr. Wolf is an expert not only on the UN sanctions, but also US sanctions and EU sanctions as well, because I understand that he provides guidance on compliance issues. So he's joining us. He waited a long time all the way from Washington, so thank you. He is a partner attorney at Crowell and Mooring law firm. He will be speaking in English. It's over midnight, I believe, so I can give you 15 minutes. Thank you for joining us. Please go ahead.
Thank you very much, and good afternoon / good morning. Apologies that I cannot be there in person, but as everyone knows, quarantine has made that impossible. The upside, of course, is that I can present to you without a mask on. The downside is you're stuck looking at my guest bedroom wall furniture behind me, so I apologize for that. I hope everyone, including their families, their immediate circles, and all of your friends and relatives are safe, both from COVID and the pandemic issues, but also the recent typhoons I understand have been affecting the region. Everyone may be wondering, why am I here? Why is a lawyer from Washington dialing in at 1:30 in the morning to present to the panel? And as was just mentioned, it's because these are the types of issues that I work on all day, every day on behalf of clients. The policymakers create the sanctions, and then they end up everyone else has to turn to lawyers to help them apply them. So I work with corporations and paying clients, but often a number of NGOs and nonprofit clients trying to navigate a lot of these issues that were poignantly raised by many of our panelists, including most prominently Ms. Yoon. I would note I'm speaking personally, so not on behalf of the law firm or on behalf of any of our clients. And I'm also going to help try and provide a little bit of the context and explanation for the sanctions, but in doing so, I'm not in any way trying to say whether I agree with them or not. As Ms. Yoon made the compelling and passionate case, the impact of sanctions can be quite severe, and I have no intent to discount that. The goal is to summarize the current state of sanctions, as well as add a little color to Mr. Lee's description of the exemption process, and then perhaps pose a question or two back to the speakers and panelists about, while many of us can't be the ones that independently change the rules, if we had one suggestion to policymakers, what would that one suggestion be? So as mentioned earlier, I'll focus comments just on the UN exemption process. There are numerous overlapping sanctions, most prominently the US as well, but a number of other countries. I'm happy to talk about those. But the panel has been focused on the UN sanctions, so I wanted to focus on those. As noted, the UN sanctions are not comprehensive. It's not a prohibition on all transactions with North Korea. The challenge, of course, is the restrictions that came in place at the end of 2017, and most prominently for most of our NGO community has been the export and import restrictions those imposed. So the export restrictions that ended up capturing virtually all medical products, metal products, and therefore capturing most medical products, as well as the import restrictions that effectively cut off most North Korean ability to export, so textiles, seafood, et cetera. As was noted, the UN has always stated that they have no intention to have an adverse effect on humanitarian trade. Every UN resolution on North Korea says that. It has a particular paragraph on it. Of course, it has exactly that impact. As Ms. Yoon noted, the implementation of these restrictions did quite clearly and almost immediately have an impact on humanitarian trade, the ability to export products to North Korea, the ability to import products from North Korea, and the ability of NGOs to operate on the ground. The UN did say that they were going to try and create an exemption process. That took almost a year from when the sanctions were first implemented. So the UN ramped up in late 2017 until the first exemption to UNICEF and then ultimately our client Eugene Bell Foundation was issued in late 2018. That process, that initial setup process, was a giant pain, and almost everything was shut down in the middle. The last time I had the opportunity to be in Seoul was in, I believe it was October 2018, at which point the UN had announced what the process would look like, but nobody had gotten an exemption yet. So everybody was sitting there trying to grapple with, how is this going to work? And is there a way that we can make this work that's in any way practical? do I have to apply to a UN committee? What do I do? Ultimately, what ended up happening is they've now published an exemption guideline on their website that says nonprofit organizations or international organizations can apply to the UN for an exemption in 3 ways. You apply either through your member state. So if you go to the website, you'll note many NGOs have applied through Korea, for example. France is another one that often applies for their NGOs. If your member state won't apply for you, and some will not, then you can apply directly through the UN High Commissioner. If for whatever reason that doesn't work, an NGO can apply directly to the committee. Now that sounds great, but as was commented on earlier, it's a formal process. And there are a list of, I'm looking at now, I think it's 13 specific requirements that must be included in that application. Everything from the specific products you're going to send, who's the manufacturer, what are the dates and routes of the shipment, how are you going to use them, the very strong focus on how you're going to control for diversion risk. So, or how are you going to make sure this is used for medical purposes or not for medical purposes. And so it can take a lot of time to pull that together. But once you do, you put it in. The challenge was for the first probably 12 to 24 months of that process, that was just the start of the dilemma. You put in the application, and then when we did that for clients, we often saw numerous responses, numerous questions from members of the 1718 Committee of the UN asking for clarification on the shipping route, or asking for why this product was needed, or asking any of a number of things that ended up delaying the request. What we have seen more recently is a pretty decent improvement in that process. And I'm interested to hear other panelists' feedback on this. But over the last, I would say, 6 to 12 months, the UN process has gotten a lot cleaner in several ways, based often on this type of feedback, where the NGO community was reaching out and saying, this is not possible. I can't work with a lawyer in Washington to apply for something, spend 3 years, and then ultimately get something back, because then I need another one 6 months later. So make this better. So they've done a couple of things. One, what we have seen is, at least for repeat applicants, so somebody who's applied before and is now coming back asking for a new exemption, those are being turned around in 1 to 2 weeks, rather than 6 to 12 months. 1 to 2 weeks is feasible. That's something you can work with as a business or as an NGO. Second, we've seen a much broader willingness and acceptance of products. So for example, our initial application on behalf of Eugene Bell, we had an exemption list that contained a huge amount of medical equipment, as well as some building supplies for some patient wards. All of that was approved. The committee ended up rejecting the request for a container of pens, 1 microphone, and 1 portable speaker. Don't know why. Ultimately, 6 months later, we just got a second grant in the mail in which they added those 3. We didn't ask again, but they added them anyway. And more recently, we've now seen, and all of this is public, you can find it on the UN website, so you can see all of the NGOs that have what they've been granted, but you've seen numerous NGOs get grants for example, vehicles, or grants for the refined petroleum or gasoline that was referred to earlier. So the committee is willing to move past the gauze and the stethoscopes and the specific medical equipment that was mentioned earlier into the items that I would sort of call necessary and incident to medical work. If you can make an argument that this is necessary for your delivery of humanitarian aid, I've seen the committee willing to accept those arguments. And then finally, in an acknowledgement of the sort of COVID-related risks, the committee has been, initially the rule was exemptions are only good for 6 months. The committee pushed back and said, we very strongly want our NGO community to, within every exemption, say, here's what I need in the next 6 months, and consolidate that into 1 shipment. You've heard many of our previous panelists talking about some of the logistical challenges getting into North Korea. That's incredibly hard to do in the best of times. And now, with a quarantine in place in China and most countries, and particularly on the import side into North Korea, a 6-month timeline is not feasible. And so at a minimum, the committee has now come back and extended and been willing to grant exemptions that are in place for at least a year. That may still not be good enough. You will see many exemptions that have been granted immediately prior to COVID, and it remains to be seen whether or not North Korea will allow imports during the pendency of that exemption. But the committee has acknowledged that impact. I would say they also have appeared willing to, when we've had to ask for what amounts to a renewal because we couldn't use the exemption because of COVID, the committee has been willing to grant that. All of that was to be said, saying there have been improvements. Not to say the process is easy and not to say there doesn't need to be further improvements. The UN exemption process has, as we just talked about, improved a little bit, but there are a myriad of overlapping other restrictions that our other panelists have talked about. So for example, and probably most prominently, other unilateral member state sanctions. So the one that has been raised several times today is the United States. The United States has export restrictions, sanctions, travel restrictions that apply to a wide variety of actors, and anybody who's a US person, anybody who uses US banks, anybody who uses US organizations. So it ends up having a much broader impact than you might otherwise think. But the US is not alone here. The EU has its own set of unilateral sanctions, and as does Japan and a number of other countries. And so depending on the organization's home country, you're often working through not only that UN exemption process, sometimes the US process, sometimes your local process, the Chinese process in order to import anything. So every one of those restrictions remains challenging and needs work. Another comment that was made earlier that I think is worth raising is the sanctions have a indirect impact often. First step is, okay, let's get the legal permission to do this. I have an exemption or I have a license. Often that's not enough. Often your counterparties will say, I don't care. Even if you can prove to me that it's permissible, I still don't want to do it. And this comes up most prominently with the banks, where the banks, many of whom maintain a policy that says, I'm not going to do North Korea activity. It doesn't matter whether it's humanitarian or not. It's too difficult for me from a compliance perspective. And so I'm sure my co-panelists would recount similar stories, but what we've seen from many of our NGO clients is a real challenge to take the actual license and convert that into a bank willing to process even a payment from the US to South Korea. It's not a payment trying to cross the North Korean border, but trying to get to South Korea. If you say this is to fund travel to North Korea, your US and your South Korean banks will have all sorts of challenges with it. So there's a very real practical challenge from a sort of global community perspective of how do you take essentially the derivative impact, even when the authorities say it's okay. And as we talked about, that's really challenging. But even when they say it's okay, how do you then convince the rest of the community to be willing to accept that permission and process the transactions? And then you now have the sort of final leg of that set of challenges, which is the North Korean response, which is, as we've talked about several times over the last hour and a half, the almost complete curtailment of NGOs' ability to operate in country post-COVID. So NGOs were already challenged to operate in country to navigate the North Korean system. But now with virtually no product entering country and very few people willing to or able to enter country subject to typically a 1-month quarantine, you have seen a sharp cutoff of even the permitted and UN exempted trade. So you've got UN challenges, unilateral member state challenges, practical global community challenges, and then practical North Korean incoming challenges. With all of that, I guess I would sort of conclude with one question back to the panel that I'm also happy to answer, but I'd be interested in others' comments, which is, given all of that, and given that at least I don't think any of us on the panel or on the call have the ability to unilaterally change any one of those sets of challenges, what should be the one thing, or what would be the one thing you would want changed? If you could write the letter, if you could, at a stroke of a pen, change one restriction or change one practical issue, what would it be and why? And with that, thank you very much. And again, my apologies, I couldn't be there in person, but I really look forward to the discussion.
예, 감사합니다.
Yes, thank you very much. All the way from Washington, Mr. Wolf joined us. I think that about 2 to 3 years ago, when the Korean NGOs held a meeting, I understand that Mr. Wolf had gave us advice that the sanctions are not that difficult. It's worth challenging the sanctions. And a lot of NGOs actually signed up or applied for exemption because of his advice. So Ms. Joy Yoon said that it took 3 years for the exemption case to go through, but now that period has shortened. So the exemption process has been simplified to some extent. So we are grateful for that. So the exception, the Korean word for the exemption is 면제. That is the official wording that we use. So we have heard from the 4 panelists, and we have some questions that we have received through our online platform. So why don't we raise the 4 questions, and then we can receive or listen to the response of our speakers and panelists.
So Mr. Lee Kyu-chang had posed us a question to Ms. Yoon about how she came up with the number 4,000, the death total 4,000. And you said it took 3 years to get the exemption. Why so long? And what did you do for the 3 years? In particular, regarding UNSC or U.S. government, what kind of efforts did you make against them for the 3 years that ultimately led to the exemption? So people are wondering the specific process of that. So those 2 questions to Ms. Yoon and to Mr. Lee. There we have a few questions. Maybe Mr. Lim can also answer. We heard that there is remarkable progress made in terms of malnutrition in numbers. So this is relative progress, not absolute. And WFP in 2020 announced that 35% of the North Korean people still have chronic hunger. So what's the difference between the 2 numbers? Because they seem to be contradictory. So the question about data. Malnutrition, if malnutrition and hunger is the same, why do we see 2 different numbers? And question number 2 to Mr. Lee Ju-sung. UNSC impact to food production in the DPRK you said was very little. And the question is that in terms of fertilization, fuel, farming equipment, because of the import sanctions and import ban in the mid to long term, wouldn't the sanctions have an adverse impact on North Korean food supply, although it may not be very visible right now? So could you clarify as to what you meant when you said that sanctions have little impact on the food supply in DPRK? And another question to the WFP. The difficulty of transportation. I'm sure that the WFP has its own vessel. So is there any challenges as to transporting supplies by WFP to North Korea? So those 5 questions to the presenters and discussers. Please answer them, and then we'll have another round of discussions. Please be brief. Why don't Mr. Lee go first? Thank you for the question. And before that, as Mr. Lee Kyu-chang has mentioned earlier, the international community said that there's more than 6 million tons of food supply from DPRK. That's based on the Agricultural Department of the DPRK. And I think there's a difference between before and after processing rice. So the number before processing is 6 million, but the other statistics means post processing. So the numbers differ, but we do need to look at the general trend of where the numbers are going. And likewise, is there any error in the data and numbers? Well, as for these data, international organizations enter the DPRK, receive their help in collecting data, and they gather the numbers with the help of the DPRK officials. So we do understand that the numbers we have may not be completely accurate. But I think we still can tell the general trend by combining all these numbers, although each and every number may not be completely accurate. You can still paint the big picture. The big picture clearly shows an improvement in malnutrition. So you should see a bigger picture rather than just zooming in on just individual numbers. And secondly, yes, improvement and progress are there, but DPRK is still far from perfect and needs more help. In terms of famine, I said that DPRK is number 91 out of 117 countries in the world. So the DPRK needs help still. So that is the big picture I am referring to, rather than focusing too much on each and every number. Because depending on where the number comes from, how it is reported, and who does the survey, the numbers may vary. And as for food production, in 2016, after the fourth nuclear test, sanctions against North Korea were intensified. Nevertheless, in 2016 and 2017, in that time frame, although food production slightly went down, it rebounded back up, although the absolute number is still not large. But that overall change is not very large. And so all in all, sanctions, just to say that the sanctions had a huge impact on food supply, we do not have enough data to support that argument. But the problem is the first half of this year, because import from China to the DPRK dropped. So fertilizers were imported from China, less than a tenth of what was imported last year. So this will lead to farming, of course. And because if fertilizers are not enough, there aren't enough fertilizers, they will lead to a drop in crop yield. And secondly, natural disaster, climate change, flooding, typhoons will definitely have an impact on the DPRK, so we need to keep a close eye on what happens on that front. And another thing is DPRK has an absolute lack of food, so they need to import food from elsewhere, but that import amount is very little. International aid and import are both quite hindered. So this year, all in all, DPRK's food supply will be very low. That is all.
감사합니다.
Yes, thank you. Ms. Choi Yoon, can you respond? Yes, I will speak in English.
First of all, I would like to answer the question regarding the possible 4,000 deaths in 2018. And this comes again from the extensive report of which I'm only one of the authors. There's independent experts that came together to create this report. To be honest with you, the full extent of the humanitarian impact of sanctions on the DPRK is unknown. Currently, very few people are on the ground, and so we have the inability to know the actual data. But the data of 4,000 possible deaths in 2018 came from a report that was actually compiled by Key Park, who is going to be a presenter in another section of this forum. And it was based on the needs and priorities of the 2018 report done by the United Nations agencies in the DPRK. These information was based upon the lack of funding, the funding cuts, as well as delayed delivery of humanitarian assistance through the UN agencies in the DPRK, particularly emergency reproductive health kits. And so the information presented presented in the 2018 report by the UN and the estimated number of aid that they were planning to distribute in the DPRK versus the number of kits that they were actually able to distribute was calculated using published reductions in mortality rates of the intended interventions. The number of lives that may have been lost was calculated based on the difference between mortality rates with and without the interventions in the unreached population. And so the actual number that was calculated was 3,968 deaths, possible deaths in 2018. Because this is primarily based on the lack of distribution of emergency reproductive kits, 3,193 of these possible deaths were supposed to be children under the age of 5, and only about 72 deaths from pregnant and delivering mothers. And so that is where that information comes from. If you have further questions on that, please refer to Dr. Kee Park, who will be presenting in another section of this Korea Global Forum for Peace. As far as our organization, it did take us approximately 3 years to obtain all the licenses that we needed to do humanitarian work in the DPRK, primarily because we are a US-based NGO, and I am a US citizen. We have several US citizens on our team, in addition to other nationalities. And so we are obligated to abide by all US sanctions, but we also have an entity in South Korea, and so we're also obligated to abide by South Korean law as well, in addition to UN sanctions. So we started applying because of the Obama executive order under the Obama administration in 2016, and it took us about 11 months to obtain our first license through the US Treasury Department. For us, that was the biggest first step of the hurdle. And as Mr. Wolf mentioned, it was during that process where the UN was still trying to figure out how exemptions would be granted that it took us several years to be able to figure out and be able to apply for an exemption from the UN committee. But again, recently, we have been getting very quick feedback from the UN exemption committee as quick as 2 weeks, as what was also mentioned. But I would like to answer the question, what is the one thing that you would like to see happen to improve humanitarian work in North Korea? And there's really no one thing because there are so many things. But when it comes to the UN, there's already been a suggestion of a white list. So we have blacklists of partners and banks that we cannot cooperate with for the DPRK. But for humanitarian purposes, it would be very effective to create a white list. This would include medical equipment, whatever equipment that would be exempt, automatically exempt to the current sanctions that are occurring against the DPRK. Another big one is banking channel. We have to have a white list banking channel to be able to continue humanitarian work in North Korea. And this is, again, the number one reason why most nonprofit organizations are no longer able to operate in North Korea. But out of all these obstacles, there are global sanctions around the world. The greatest influence, of course, is the US sanctions, I believe. And so especially the travel permits for humanitarian workers to be able to go inside North Korea, verify the delivery of goods, and continue our work inside North Korea. The process of applying for US Treasury license needs to be it needs to be faster. It needs to be a quick turnover, especially for humanitarian organizations. And as the State Department states they are doing, we need multiple entry special validation passports that are good for a long period of time, at least 1 year, so that humanitarian workers can go in and out of North Korea and do the work that they're called to do.
예, 그 우리
Thank you. Dr. Wolf, I'm sorry, I think I mispronounced your name. And Ms. Yoon also answered the question posed by Mr. Wolf as well. And Mr. Lim, could you answer the question posed to you briefly?
그래서
Yes, well, I think I touched upon this topic when I was speaking earlier, but the ports were closed, they were reopened, but nevertheless, we are still experiencing delay in shipment. So usually we utilize the ports in Thailand and Nampo. There are delays, and this means an increase in costs by 30%, and then lead time from the time that the supply process begins or the support process begins until the actual end users receive the support. We have seen an increase in the time as well. We have received another question which is directed, well, actually this was something that was already mentioned by Mr. Wolf. He explained about the current situation. And when it comes to the UN exemption program, this is not just limited to humanitarian activities, to my understanding. A lot of Koreans, well, we're focused and interested in establishing peace on the Korean Peninsula. And we are engaging in various endeavors to obtain peace. And I think that private sector organizations are engaging in such efforts as well. Now, without ensuring that both the North and South Koreans' lives are improved, we cannot achieve true peace. And so, having said that, we have, in order to improve the lives of the people, we have to focus on nonprofit infrastructure. It's not just the medical supplies that are important. So I think that now it is time for the South Korean government to take the initiative to lead various exchange programs and support programs. But the South Korean government still is a bit passive. It only helps out with signing up for the exemptions. So, Mr. Wolf, well, the Korean NGOs, they have to not only receive the exemption from UN, but also they have to receive the approval from the Korean government, South Korean government. So I think that when it comes to the Korean NGO activities in North Korea, it should be the South Korean government that gives approval for the exemptions. And the South Korean government should play a more active role in receiving the understanding of the international community about the need of further promoting humanitarian activities by Korean NGOs in North Korea. So I think what is needed at this point is to ensure that we can have balanced development of economy in both North and South Korea and peace on the Korean Peninsula. So I think that we have to think about the big goal of the sanctions against North Korea is to establish peace on the Korean Peninsula. And that is why the Korean government should pursue a greater initiative, and that initiative should be accepted and acknowledged by the international community. So I ask of you, as a member of the international community, to take interest in the activities and the initiatives that are pursued by South Korea. So for that, of course, we need the participation and the activities of the Korean NGOs. For example, the KNCCK is leading such efforts. But we need more active endeavors coming out from the Korean NGOs. And also, we need more efforts to alleviate or moderate the obstacles that the Korean NGOs are facing. So I think that there needs also an international campaign needed to raise this issue to the 1718 committee to ensure that the Korean NGOs can more actively participate in humanitarian efforts in North Korea. So if Mr. Wolf can comment on this, please go ahead.
Sure, thank you. And I'll have to, of course, defer to many audience members and panelists on the specifics of the Korean government's role. I think what I would note is a couple of things. When this process was being rolled out, it still wasn't clear yet exactly who would work through member states and who wouldn't. It's interesting now, if you look at the list of exemptions that have been granted, the Korean government is certainly the most active right now in supporting its own NGO community. I believe it's just the South Korean government, and I believe France has one, but all the rest are either through the UN or individually. So it certainly sounds like the Korean government has heard your comments and is taking them to heart. Your comment about the need to move past medical assistance into additional areas of support and development is certainly true. It's also something with which the 1718 committee has grappled. And at the very beginning of this process, it describes the resolutions describe humanitarian assistance, but don't put a lot of detail into what that means. And there was some dispute between the various parties and the various member states of the UN and the Security Council as to how far does that go? And everyone was willing to agree that medical care, the types of work that Ms. Yoon's organization does, the types of work the WHO does, the types of work that Eugene Bell does, that clearly is humanitarian assistance. But some of the other sort of capacity building, civil society capacity building projects, there were some member states that thought that that was clearly humanitarian. And there were some others that thought that looks a lot like economic development. And there was disputes about that at the time. And you saw very early in the process, the list of public exemptions was very much skewed towards just medical. Now, if you look at it, there are some that are veering more into sort of additional areas of civil society growth and development. I'm obviously not a participant in the 1718 committee process. I'm not a participant in any one of the governments, so I can only speculate as to the conversation. But seeing the output of the committee, it does appear that there has been more willingness to accept some of the arguments that you're making about the importance of that type of work in order to continue to promote the humanitarian sector. And since I have the floor, I'll just note, I agree completely with Ms. Yoon's comments on some of the areas that would be ideal areas to focus. And in particular, the whitelist idea, given the way the UN sanctions are structured and that they're focused on customs codes and very much on sort of product basis, it would be very easy to modify that list to exempt certain customs codes. And it would not be a challenging sort of practical step for them to take. Politically, of course, it would be up to the committee and the member states to reach that conclusion. So thank you.
Thank you.
Mr. Lee? Yes, we are facing a huge challenge in 2018. When I met with North Korean colleagues, we thought that we finally had the breakthrough we were waiting for, and we were ready to engage in real work. And so we met face to face, but actually we found that there are sanctions, we need to get the approval for exemptions, we need to get approvals elsewhere, and no work could be done. The groups that actually did the farming had to rely on wheat. Healthcare groups only had to provide wheat. So in the past 25 years of trust building and all the achievements, all just boiled down to providing wheat to the DPRK. That was all we could do. Even if we can meet at a private sector level between the two Koreas, we learned that there's nothing we could do back in 2008. That was when sanctions started to work. But when we returned from North Korea, we did much work. We received the exemptions. We persuaded the government, but it took a very long time. And even if we get the exemption from the UN, China or a third country, purchasing items from those countries, we couldn't wire transfer and pay for our items because of the U.S. sanctions. And UN sanctions were not the problem. It was the U.S. sanctions that was too stringent for us to do anything. Tamiflu was mentioned earlier. South Korea offered to provide Tamiflu to North Korea. But in the end, it came down to sanctions because of how to transport Tamiflu. And all the process prolonged, and in the end, North Korea couldn't wait any longer and said they didn't need Tamiflu anymore. So there is the ultimate fate of NGOs in Korea. Providing humanitarian support is not the end. Providing humanitarian support for North Korea is directly linked to support for our own children. Helping the people of DPRK helps the people of South Korea. Just to take COVID-19, for example, or the swine fever, that epidemic knows no borders. The impact of the outbreak in the DPRK will impact us. So all we want to do is to help ourselves. Efforts of the Korean NGOs, South Korean NGOs, are not simply focused on the DPRK. It is a matter of the Korean Peninsula as a whole. It is a matter of our future. And that is what the sanctions is hindering, our future. Korea used to be at war, used to shoot at one another, and that makes things more complicated. But at least when it comes to humanitarian support, even if we have distrust and even if we are afraid of one another, humanitarian support can be the only way possible for us to build trust. Nevertheless, we do not provide humanitarian support because we trust one another. We provide humanitarian support to trust one another. People say, how do we trust the DPRK? I agree, we cannot. But same wise, how can the DPRK trust us? The private sector tries to trust the DPRK and tries to build trust for DPRK. And we need the international community's support to perpetuate peace on this peninsula, and for the people of Korea can play an important role in the international community and take responsibility to make a better world. South Korea and the DPRK, I hope one day plays a model role in doing so, and I hope that in the process we can be in solidarity with other international NGOs and groups. I ask for the support of international community, the government of South Korea, and I pledge that we will do what we can.
부장님의 감동.
Yes, thank you very much. That was a very heartwarming remarks. Impressive. Thank you very much. Now, the organization that I represent, the South North Korea Exchanges and Cooperation Support Association, supports the application for exemptions to the sanctions. We have a number of questions related to the whitelist and exemptions for the sanctions. Now, if you visit our website, we actually have a publication, and we also have a handbook titled It's Okay, North Korea Sanctions, which you can download and read, which explains about how you can deal with North Korean sanctions. So because of the time constraint, we'll not be able to further take any questions. We have been here for 2 hours, and through the discussions, we were able to look at some of the challenges that we are faced with in terms of sanctions against North Korea. So I think that good ideas and comments were exchanged. Now, in Korea, we say that all humans are equally special and equally precious, and everyone has a same equal rights. And I think that this also should be applied to North Korean people as well. They should be ensured their rights regardless of their surrounding political situation. In order to establish a peaceful Korean peninsula, I do ask for your continued support and interest. I would like to thank all the speakers and all of our panelists and our audience joining us through the online platform, and especially Mr. Wolf. Thank you for joining us at such a late hour. Thank you very much. This concludes our session.